So today we'll be discussing about the thrombocytopenia in the cirrhotic patients or in CLD, chronic liver disease patients. Now, what is the reason for thrombocytopenia? So we are not discussing thrombocytosis. We are discussing actually about penia, which is reduced number of platelet count. Now, there are a few reasons for that. One of the most important reason is the thrombopoietin. Now, this thrombopoietin is one of the key regulator for platelet function, which is mainly produced by liver. And we know that in CLD, there is significantly reduced levels of thrombopoietin. That is one of the main reason why the platelet count is very much reduced. The second reason is because of the bone marrow suppression, because of the toxic chemicals which get accumulated over because of the poor function of the liver. So bone marrow suppression is one of the main reason why there is thrombocytopenia. Other things, like if the patient is chronic alcohol itself is a directly toxic substance for production or for survival of all the cell lineages, like it can be RBCs, WBCs, or it can be platelet. So alcohol itself causes destruction of the platelet and causes reduced production of the platelets. The other things, like for platelet production, body needs folic acid, and in very commonly because of the malnourishment, because of the malnutrition, because of the excess alcoholism, because of associated smoking or tobacco, the folic acid deficiency is pretty common, and that causes thrombocytopenia. The other important reasons for the thrombocytopenia is hypersplenism. Now we know that very commonly CLD means cirrhosis. Most of the time, the patient will have portal hypertension. So portal hypertension means there will be increased pressure into the portal vein, and as we know, this portal vein is actually made up of the superior mesenteric vein, inferior mesenteric vein, and splenic vein. And whenever there is increased pressure into this pressure is reflected into all the veins. And the splenic vein, as there is increased pressure in the splenic vein, the spleen, uh, which is drained by the splenic vein, there is increased congestion of the blood into the spleen, so that overall eventually there is increase in the size of the spleen, so splenomegaly can be there. And very commonly because of the CLD, because of the cirrhosis, the platelets are unnecessarily damaged in excess, which is we call it as hypersplenism. So in hypersplenism, basically the WBCs, RBCs, and platelets as well, these are unnecessarily damaged by this abnormally functional spleen. Hence, there is very commonly thrombocytopenia. So these are all the reasons why there is thrombocytopenia, which is very common. And the most of the time, this thrombocytopenia is not problematic, and most of the time, patient does not need platelet transfusion until and otherwise they have active bleeding. So most of the time, if the platelet count is more than 30,000 also, patient doesn't need platelet transfusion. As soon as it is usually less than 30,000, and if the patient has some bleeding tendency or bleeding thing which is apparent, like if the patient has melena, hematemesis, then definitely the patient need platelet transfusion. So this is all for today, and thanks for your listening.